Hi friends, good evening. Welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for ESIC Nursing Officer exam preparation and the exam is on 7th July. We can see today's question. First question, a neuromuscular blocking agent is administered before ECT. The nurse should carefully observe the client for options. Option A, respiratory difficulty. Option B, nausea and vomiting. Option C, dizziness. Option D, seizures. Here the question is, a neuromuscular blocking agent is administered before giving ECT, electroconvulsive therapy. Example for neuromuscular blocking agent while giving ECT is succinylcholine. Okay, so after administering this neuromuscular blocking agent, what nurse will carefully observe for the patient? Nurse will observe a respiratory difficulty for this patient. Okay, option A is the correct answer. And the next question, hysterical fits are also known as options. Option A, dissociative amnesia. Option B, dissociative convulsions. Option C, dissociative motor disorder. Option D, none of this. Hysterical fits is also known as dissociative convulsions. Option B is the correct answer. And the next question, location of primary motor area is options. Option A, frontal lobe. Option B, temporal lobe. Option C, occipital lobe. And option D, parietal lobe. So where is primary motor area is located? It is in frontal lobe. Option A is the correct answer. And the location of auditory and olfactory area is temporal lobe. Okay. And location of visual area is occipital lobe. And the function of parietal lobe is somatosensory function. Move on to the next question. The hormone secreted by alpha cells of pancreas is options. Option A, insulin. Option B, glucagon. Option C, cortisol. Option D, somatostatin. So the hormones which is secreted by alpha cells of pancreas. Pancreas is an example of both exocrine and endocrine gland. In this, alpha cells secrete glucagon and beta cells secrete insulin and delta cells secrete somatostatin. On to the next question. Which hormonal contraceptive measures are not used in breastfeeding mother? Options. Option A, mini pills. Option B, DMPAA. Option C, combined OCP. Option D, condoms. Among this option, which contraceptive measures are not used in breastfeeding mother? Second option, DMPA. Full form of DMPA is dipod-medroxyprogesterone acetate. Okay, this is one of the hormonal contraceptive. Our question is, which is not used during breastfeeding? It is combined OCP or combined oral contraceptive pills. It is not used during the time of breastfeeding. Move on to the next question. After 7 days of vaginal delivery, which type of lochia come from vagina? Options. Option A, alba. Option B, rubra. Option C, serosa. Option D, none of this. Our question is, after 7 days of normal delivery or vaginal delivery, which type of lochia? Lochia means the vaginal discharge coming during the time of puerperal period. That means after delivery. So which type of lochia will come from the vagina? Types of lochia include lochia rubra. It is red in color. It is from first day of delivery to 4 days. That is 1 to 4 days. Lochia rubra. And lochia serosa from 5th day to 9th day. Okay. It is yellowish or pink or pale brownish color. Pale brownish, otherwise pink or light yellowish color. That is lochia serosa from 5 to 9 days. And lochia alba is pale white color. It is from 5th day to 15 days. Okay. So here our question, after 7 days of vaginal delivery. So it is lochia serosa. From 5th day to 9th day it will be serosa. So answer is option C, lochia serosa. And the next question, antidote of arsenic poisoning is options. Option A, D-penicillamine. Option B, dimercaprol. Option C, deferoxamine. Option D, digibant. Antidote of arsenic poisoning. It is Dimercaprol. Option B is the correct answer. And antidote of iron overdose is deferoxamine. And antidote for copper poisoning is D-penicillamine. And antidote for digoxin is Digibend or digoxin immune fab or Digibend is the antidote of digoxin. And the next question is universal antidote is. Which is the universal antidote? Options: option A D-penicillamine, option B activated charcoal, option C protamine sulfate, option D Digibend. Universal antidote is activated charcoal. Option A is the correct answer. D-penicillamine is the antidote for copper poisoning and protamine sulfate is for heparin. Digibend or digoxin immune fab is the antidote of digoxin. Here universal antidote is activated charcoal. And the next question, antidote of benzodiazepine is. Options: option A physostigmine, option B fomepizole, option C deferoxamine, option D flumazenil. Antidote of benzodiazepine or diazepam is flumazenil. Option D is the correct answer. Antidote of benzodiazepine or diazepam is flumazenil. And the next question, which size of cannula used routinely in general ward? Options: option A 18 gauge, option B 20 gauge, option C 22 gauge, option D 24 gauge. Our question, routinely or normally in general ward, which size of cannula is using? It is 20 gauge. 20 gauge is pink in color. And the next question, most commonly used cannula for blood transfusion. Options: option A 18 gauge, option B 20 gauge, option C 22 gauge and option D 24 gauge. Commonly used cannula for blood transfusion, that is the question. Color of different size of cannula we can see. 14 gauge cannula is orange color, 16 gauge cannula is grey color, 17 gauge is white color, 18 gauge cannula is green color and 20 gauge is pink color, 22 is blue color, 24 gauge is yellow color and 26 gauge is purple or violet color. This is important. Color also they can ask questions. Our question is, for blood transfusion, which size cannula is commonly used? It is 18 gauge cannula. Option A is the correct answer. 16 gauge can also use, but commonly used question we have to see, commonly used cannula is 18 gauge, but 16 gauge can also use for blood transfusion. 24 gauge, option D. 24 gauge is yellow color, which is mainly used in pediatric cases. And also another one important point, before sending the patient to OT for surgery, operation theatre for surgery, which type of cannula we will use? This also one previous year question. So we will use 18, either 18 or 20 gauge. Okay, if needed blood transfusion and all, mostly we will prefer 18 or 20 gauge for OT. And most preferably using cannula in general ward is 20 gauge and pediatric cannula is 24 gauge. It is yellow color. Friends, today in this video we discuss previous year questions. So I can give you very less question today. In the coming videos I will add more questions. Surely these questions and important points will helpful for your exam preparation. And if it is useful for your studies, please share my videos to your friend circle.